So I want to talk about cardiomyopathy versus congestive heart failure. And me personally, I don't think the two are really synonymous. So if I think about cardiomyopathy, it literally means heart muscle dysfunction or pathology. So that could be a problem where the heart doesn't squeeze well, called systole, or doesn't relax well in diastole, or a combination of both. And there's many different causes for cardiomyopathy. A lot of times when the heart function is low, we call that reduced ejection fraction, 15, 20, 30, 40, 45%. Those are all levels of reduction. But that is the cardiomyopathy that we would see. I reserve the term congestive heart failure for people who are having symptoms from the cardiomyopathy. Now, the symptoms could be shortness of breath would be most common, or lower extremity swelling known as edema, or abdominal swelling. So there's a lot of things that can be related to cardiomyopathy, maybe even fatigue, and that would be a sign of congestive heart failure. So I don't like to use the term congestive heart failure unless people are having symptoms, and therefore we will say they are in congestive heart failure due to cardiomyopathy. But that's what I would like to say is my distinction between the two. It is often just semantics, but I think congestive heart failure really just connotes is just a damaging or derogatory term. It doesn't instill confidence in people when they think they've got heart failure. That sounds really bad, and I don't think that's really beneficial for people's recovery. So let's say that you have cardiomyopathy, but if you're not having symptoms, you're not in congestive heart failure. Open to any questions or thoughts regarding this, but I think it's a distinction that really no other cardiologists are making. The terms are used synonymously, and I really don't think that they should be. I don't think it helps anybody with that.